we'll call to order the January 31st, 2019 meeting of the Spokane Regional Health District Board. Ann, do you like to do the roll call?
Michelle Fossum, legal counsel.
Chuck Atman, appointed citizen.
Brian Beggs, Chair, City of Spokane.
Ben Wicks, City of Spokane Valley.
Ray Byrne, Environmental Public Health Division Director and Interim Administrator.
Mary Cuny, Spokane County Commissioner.
Bob Lutz, Health Officer.
Linda Thompson, City of Spokane Valley.
Andrea Frostad, appointed citizen.
Kevin Freeman, City of Millwood.
Karen Stratton, City of Spokane.
Don Condon, citizen.
Josh Kern, Spokane County.
All right, thanks, everybody. And we now have up to 30 minutes of community input. And the first person on here for 3 minutes is Jacqueline Gallagher. And I also wanted to recognize my new vice chair, who's going to be the timekeeper, Councilmember Wick.
Hello, my name is Jacqueline Gallagher. I was intending to address the dramatic contradictions we have heard to the question, were the mumps exclusions voluntary? And I will just quote Dr. Lutz when he was asked that question in September 2017 meeting. His answer was, and I quote, "Voluntary exclusions is an oxymoron. There is no such thing." When asked the same question in December of 2018, he replied, "The exclusions were voluntary." I will leave it at that for today. I want to talk about the measles in Clark County and clearly detail the parallels between this outbreak and our Marshallese mumps experience. First off, the dangers of measles is being greatly exaggerated, just as the mumps was here. It shows that in 1959, there were 16,649 measles cases with a single mortality. In 1960, there was 13,678 cases, again with a single mortality. Hopefully, in the 60 years since this medical system's ability to treat measles has improved to reduce the mortality rate even further. Second, vaccination and exemption rates have been misrepresented. The Clark County Health Officer, Dr. Melnick, initially made this ridiculous claim that 22% of Clark County kids were missing MMR vaccine. That number went viral, but was quickly refuted. So now the true statistic, which is only 5% exempt, is starting to be used in articles. Here in Spokane, we only have a 4.6% MMR exempt. This is no crisis. Third, the same way we had a Marshallese mumps outbreak, Clark County is having a Slavic measles outbreak. Please Google measles outbreak starting in a Bible study to verify this. Virtually all cases have been in this religiously exempt group. The exposure sites lists are not where random exempt students are infecting each other in some public places. There are not enough exempt students for that to happen. The exposure sites are where the Slavic kids are visiting before they become symptomatic. I should know, I'm active in the vaccine choice community, and none of the exempt students have caught it. Watching the interviews with the European school principal is so refreshing. He is so confused why measles cases are even a story. He is acting the same way as a Washington State school principal who would have reacted in the early 1970s if a news video van had showed up and said, "We are here for the measles disaster you are having." They would have been shocked too. Measles isn't newsworthy, and I truly hope that you will return a critical eye towards any calls to take an excessive response to this minor outbreak to what used to be a routine childhood infection. Thank you.
Thank you. Next I have Bethany. I'm not sure how to say your last name, but Chet.
There's so much new science coming to the forefront that is changing everything we thought we knew about health. Epigenetics is the study of changes in organisms caused by modification of gene expression rather than alteration of the genetic code itself. The external environment's effects upon genes can influence disease, and some of these effects can be inherited in humans. Studies show that environmental factors are altering our DNA. This is becoming much more common with each generation. Not only are we damaging the earth, but we are damaging ourselves as well. What we ingest, inject, and absorb all matter. With these methylation pathway variants, like MTHFR, which is the methylene tetrahydrofolate reductase deficiency, trace amounts matter. Right now, 30 to 50% of the population is estimated to have this variant. We now know through studies that injection can create a more negative impact on the body compared to ingestion or absorption. We also know that the wrong cell-mediated immune response, Th2, is triggered via vaccination, which can trigger autoimmune conditions. There are many renowned high-level scientists and doctors who realize that genetics matter, and the next real step in health and safety involve understanding this better. Dr. Gregory Poland, head of the Mayo Clinic's Vaccine Research Group, is quoted as saying, "Adverse reactions to vaccines may be in part genetically predetermined. The current science doesn't allow for an informed understanding of an individual's genetically determined risk for an adverse event due to a vaccine. The most basic right that anyone should have is what happens to their own body or their child's health decisions. I find it ironic that the medical and scientific community can demean the average parent's intelligence in regards to medical decisions. Yet, on the television every day, we see pharmaceutical ads aimed at the average person, enticing them to ask their doctor to write a prescription. It's disturbing in America that the pharmaceutical industry is destined to profit from our loss of freedom. And to top it off, we have no legal recourse against the manufacturers of these injectables. This pain will have an increasing impact as genetic variants become more and more common as time passes. The UN's Universal Declaration on Bioethics and Human Rights has important principles relating to bioethics in regards to informed consent. Any preventative, diagnostic, and therapeutic medical intervention is only to be carried out with the prior, free, and informed consent of the person concerned, based on adequate information. The consent should, where appropriate, be expressed and may be withdrawn by the person concerned at any time and for any reason, without disadvantage or prejudice. Medicine can be considered an experiment, simply because we are all unique and will not all react the same way to just about anything you can think of. So choice should always exist. Physician and signer of the Declaration of Independence, Benjamin Rush, had uncanny foresight when he said, "Unless we put medical freedom into the Constitution, the time will come when medicine will organize into an undercover dictatorship to restrict the art of healing to one class of men and deny equal privileges to others."
Thank you, Ms. Sheff. Your time's up. Thank you. Rosemary Walden.
The secretary, or whatever she's called now, no offense, has received a copy that's supposed to be directed to each one of you. I trust when you receive it that you will read it and thereby enlarge your frame of reference. I won't say much other than to introduce myself as a former resident of the fluoride-free city that was used as the non-fluoridated control in the New York State Health Department's 10-year evaluation of fluoridated Newburgh, New York, and what it did to its children. That is the only completed fluoridation experiment in the United States. And the reason that you don't hear about it in preference to Grand Rapids, Michigan, which was aborted, that study only lasted 5 years because by pipeline intertie, the non-fluoridated control city became fluoridated, which negated any of the variables, including bioaccumulative toxic effect. I won't say too much more, except that I ditto what has already been stated to you by the two previous ladies. I don't have anything to do with that organization other than I applaud what they are doing because I once did it myself. I'm still doing it now, but my background and ongoing research, which has included the past 50 years and continues, is partly promoted by my being a life member in the National Health Federation. And I encourage you to go to their website. This is their latest publication, and avail yourself of the information there. I'm the individual that sued the city of Spokane in 1984 and stopped it from illegally as well as unethically mandating fluoridation. I have been attending these meetings since 1997 for the express reason that at that time, previous members of this board had hired a health officer who was biased in favor of fluoridation. That health officer was unanimously fired by that preceding board in 2006.
Thank you. Next I have Kim. I'm not sure the last name of the sergeant Hicks was. Helen.
Okay, hello. So this is just in relation to the new initiative, HB 1638, and I just had a few thoughts I wanted to share with you on that. If this were to pass, of course, this is to remove the philosophical exemptions on the MMR vaccine. I'm sure you're familiar. But if this were to pass, not only is this going to open up a lawsuit against the state of Washington, its constitution, but we all know that adding the rest of the vaccines would be the next step, as well as removing the religious exemption. With hundreds of vaccines in testing, each new vaccine would be added, so this mandatory vaccine list with no liability to the vaccine makers. Once it is mandatory for children to attend school, will it stop there? Will it eventually be mandatory to join outside sports teams, etc.? Do we then make it mandatory for adults to have a job or to travel? What other medical procedures will be mandated? And I'm just wondering, are you really okay with forced medical procedures upon your healthy family moving forward? When does this cycle stop once it starts? It is really a very slippery slope. In your packet that you have today, there's a list of all those who have sponsored this bill. And we know that it is not part of your legislative agenda, exemptions. We've talked a lot to extreme length about this at these meetings. So I would like to ask that you would please reach out to them and let them know that removing exemptions is not Spokane Health Board's priority. Thank you for your time.
Thank you. Next, Paula Smith.
Hello, I am Paula Smith from Green Acres. I'd like to say that I was shocked to see the HB 1638 proposed, which would remove the philosophical personal belief for MMR vaccine, but I was not. The week leading up to the bill drop, I kept saying something's fishy with the bombardment of news articles of measles cases that were being reported on. At that point, there had been less cases just 3 years ago without the hysteria, so why now? Could it be that the legislative session was starting and there was a bill about to be dropped? So the day the bill was dropped, which just so happened to coincide the same day that the governor issued a state of emergency, was no surprise why all the fear-mongering had been going on. It does seem odd that the CDC website doesn't have the state of emergency outbreak listed next to the salmonella outbreak in pet hedgehogs that last was updated Friday, don't you think? Although I had my gut telling me something bad was about to happen, I also tried to stay positive. I kept reminding myself that at the February meeting last year, Brian mentioned that exemptions could not be taken away here like they did in California because it would go against our Washington state constitution. I know ultimately you all on this board are not the ones deciding, but I wanted to come and thank you all. I'm so grateful that you listened to your constituents, took the time to read letter after letter of why exemptions were important to so many families here in Spokane. Thank you for removing the verbiage in this year's legislative agenda that had worried so many families that was on last year's. We know that you will continue to stand by our side, and we ask that you are willing to reach out to the members of the Health and Wellness Committee and the other sponsors of this bill, that you have all the emails that Kim just mentioned. And before the hearing on the 8th and let them know that you do support exemptions, just like you told us several times last year at many board meetings. Please let them know that you represent many families in Spokane area and you oppose this bill, and this is not a priority for Spokane Regional Health Board. Thank you again.
Kim Stadler.
Hi, I'm Kim Stadler of Spokane. Many of you know about my story and my daughter's story, but I'll do a quick recap. She was significantly and permanently brain damaged by the MMR vaccine 10 years ago. So I'm sure you guys can understand my concern about this new bill that's coming to pass. Swore I wouldn't cry. I'm not gonna cry. I'm also sleep deprived. Losing, and I have pretty much lost my child because of this. With this new law that we are now facing, I am having to now look at my baby and my other children who are partially vaccinated instead of fully, and it is horrifying. It's absolutely horrifying. We need to have a choice. We always need to have a choice. We're told, the last health meeting I came to a couple months ago, we were told that not to listen to emotions, but to listen to science. There's science on both sides. And I see people listening to emotions every single day. We hear about the homeless people in Spokane and the plight and the suffering that they go through, and we feel compelled to help. I am telling you there is real suffering going on in my life and lives of other mothers and fathers and children just like mine. I need compassion from you. I need compassion from every single one of you. We were told that this was not on your agenda, limiting exclusions. And I am asking each and every single one of you, regardless of if you believe in vaccines or not, to hold true to that. Because we need your help. This should never be forced. I should never have to look at my daughter, who is 18 years old, who has an IQ of less than 62 now, has no friends, has no life, is not potty trained, and I should not have to look at that beautiful boy that I gave birth to and think that I may be forced to vaccinate him the way I was with her. Please listen to us. We may not be doctors and we may not be scientists, but we have seen what has happened to our children and the suffering that has happened. We're coming up against the biggest industry in the world. Please, please listen to us. We are not lying. We're not lying. There is no money behind what I am doing today. Thank you.
Thank you. Nicole Ryley.
Hi, I'm Nicole Ryley. I spoke a few meetings ago. I am the refugee from California. I've lived already and witnessed the damage that mandatory vaccines can do to families. My brother is vaccine injured and he has severe epilepsy. It rocked our world and changed our lives. And prior to that, I didn't think anything about vaccines. I had no opinion, neither here nor there. It was just something people did. And then after we realized and we found out that he was vaccine injured, it really opened a whole new world to me. An ugly world that I would never want to see or try to look into. But we were forced down that road. I've done a lot of research, and I don't make decisions lightly when it comes to my own family. I just want freedom to do with my body and the body of my children what I see fit, just as I choose what school she goes to, what foods she eats, where she goes to, what friends she hangs out with. I just want the freedom. I want to focus my perspective on freedom. I don't want my freedoms to be taken away, and I don't want to have to join a religion just to not vaccinate my child. I don't think that religion is the only thing that's important. I think my body, my choice. Half the people that are trying to shove vaccines down our throat are pro-choice. So you can abort a child, but I can't choose what I stick in my body or the body of my child just for her to go to school. I'm a single mother. I can't homeschool my baby. That's why I moved here. I left the sun, the beach, the warmth for snow. And I did that for freedom. I want the freedom to choose many things. Many things, I mean, I think we all want to be free. And I don't want to intentionally harm other people. But it's my belief that when you're a healthy individual, you don't harm other people. I can't give you measles right now, and I am not measles protected. I've never had the real deal. I've never had the vaccine. And I'm not the plague. I'm not the walking plague. I'm a healthy human being. And so is my child. And I don't want to have to move again. I've only been here a year for freedom and bodily integrity. And I really hope that all these mothers are heard before more children are damaged, just so that they can go to school. Thank you.
Thank you. That's the last person that signed up for public testimony. Thanks everyone for coming down and sharing your thoughts with us. Next up is the consent agenda. And the first item on that are the meeting minutes of December 6th, 2018. Yes.
Chairman, I need to recuse myself from the vote as there is a voucher for Greater Spokane Substance Abuse Council where I work.
I will take that abstention when we get to the vouchers, but
Okay.
just on the minutes.
Okay.
Is there a motion to approve the December 6th, 2018 minutes?
I'll make a motion to that effect.
Second.
Any discussion? All those in favor?
Aye.
Any opposed? Abstentions? The minutes are approved. Now, we're on to vouchers, and I'll take your abstention on that.
Okay.
So is there a motion to approve the vouchers November 1st through 30th, 2018, and December 1st through 31st, 2018? There's been moved.
Second.
There's a second. Any discussion on those vouchers? Seeing none, all those in favor of approval?
Aye.
Any opposed? And I've already recognized abstention of Ms. Thompson. Any other abstentions? Seeing none, those are approved. Now down to action items. The first is something we do every year, which is set the dates of our regular meetings coming up. Sometimes we do change them, but these will be on the calendar for our regular meetings for the year. And a copy is included in your packet. Does anyone, well, I guess, does anyone have any questions or concerns about this particular schedule? Seeing none, is there a motion to approve this?
Move approval of the meeting schedule for 2019 as presented.
Second.
It's moved and seconded. Any further discussion? All those in favor, please say aye.
Aye.
Any opposed, nay? Any abstentions? Hearing none of those. The meeting schedule for February 2019 through January 2020 is approved. Next up is committee membership assignments for the board. Again, there is a preliminary list of slate of committees and members. One note, I did check with Karen Stratton, who's the chair of the Education and Communications Committee, wondering whether that committee should still be in existence. And I think you mentioned to me that perhaps they should be in existence for now until they meet and decide what they want to do in the future. And I'm just looking here. There's a strategic planning group, and I wasn't part of that discussion, and Kate Burke is the only person on it. I don't know. Can anyone speak to what the intent of that group is? Does anyone remember what that is? Okay. All right. Well, I'll leave it as is until, yeah.
Actually, I might be able
Okay.
to. When I was on the board previously, it was felt that it would be beneficial to have a board member representing the board on the strategic planning process.
Okay.
And so it was really primarily just sort of to keep the board informed and to have a board voice as part of the planning process. So that was sort of the intent.
So it's really a liaison to an existing structure within the
Correct.
district? Okay, great. All right. Any other requests or suggestions for people being added or subtracted from any of the committees? All right. Seeing none, is there a motion to approve as amended?
Oh, go ahead.
Move approval of the 2019 committee membership roster as presented.
Second.
All right. All in favor, say aye.
Aye.
Any opposed, nay? Any abstentions? Ayes have it. That roster is approved. Okay, the chair report, and I don't have anything to report other than I want to turn it over to Kevin to give us a report on the transition committee.
Thank you, Chair. We, as of the last meeting in December, the board was kind enough to approve the transition committee to go forth and select or take proposals for and select a search firm to guide our search for a new administrative officer. We went through a solicitation process and have had applicants, and the transition committee recently selected a candidate, and at this time we are in discussions with that candidate to firm up that agreement, and we hope to have that concluded here within the next week or two, and we will begin the process with that search firm, their scoping and et cetera, hopefully early in February. And that's where the transition committee is at this time. So we are making progress. We feel that we've got a very good search firm going forward, and the process should allow for not only this board, but and through members of the transition committee, but also people in the health district to have input into the search process. Thank you.
And could I ask two questions? One, I think someone else is paying for the firm, and secondly, what's the length of time that the firm is proposing till they have a candidate identified, a final candidate?
So yes, we have received a grant from Empire Health Foundation for 2018 for $50,000 toward that search firm. Empire Health is willing to discuss with us needs in the future for 2019 if we have those. So we do have that. That is not money out of our own pocket, at least at this time. Right now, I believe the schedule is we hope to, and can you refresh me, we hope to be looking at actually having an advertisement going out in early March. Is that kind of, yeah.
Spend 4 to 6 weeks reviewing the agency, and then we'll have the advertisement go out. We expect to have candidates for review between 4 to 6 months.
So we hope to have the process completed sometime in third quarter of 2019.
And one comment, that's tentative, simply because we haven't discussed with the agency yet, really what their procedures are. So hopefully we'll get it done ASAP, but I want everybody to be patient because we're going to take our time to make it right and correct. So it may be longer than that. So.
Is that a Washington State firm, the agency, or is that? I'm just curious.
Portland.
But based, as we looked at their qualifications, they've done a lot in the area. So.
Any other questions on the transition process? And your transition committee is meeting weekly, every other week?
Yeah, we meet Monday morning at 7 o'clock.
7 a.m.
And
Welcome to join us.
everybody's excited about the meeting at 7 o'clock in the morning.
I hate you all so much.
We do have one that I commented previously, that we could really start meeting at 6, but she's not willing to do that. Is that correct, Karen?
I'm just going to start staying up Sunday night. So I don't go to sleep. So I can
Great.
take time.
But anyway, Mr. Chair, is that it's a great committee to be working with, and we are progressing very, very positively in what we're doing.
So that's great news. The only other thing I'll add for the chair report is that we did have the official Torney Smith retirement party here not too long ago in this very room, and several of us were here with a lot of well-wishers, staff people, a little slideshow and things like that to send them off well and end an era. And now we have 2 co-interim directors, and I think I'm going to go a little bit out of order on under reports. And so next I'm going to turn it over to Ray for the administrative officer report.
Okay, thanks. Just 2 quick updates. One, I wanted to mention that Veteran Services has relocated out to the Valley now. So the space up on the 4th floor has been vacated, and we are beginning the process of evaluating that space and determining who'll go in there. So that was a smooth process for them, and we're glad that we could extend that for a month. And then secondly, just quickly mention with the federal shutdown, we do have several programs that could be impacted by that. At this point, they're not. As long as everything resumes to normal before the end of February, then we'll be fine. And those programs are WIC, SNAP-Ed, and then we do have our assessment program that has been doing some work under this federally funded, and that's being delayed until we know that they're back in full swing. So until then, we'll wait and see what happens. And that's all I have.
Next I have legislative report. Graham.
Good afternoon. So I want to give you some updates on the legislative agenda and progress on bills, and then talk about a letter in support of the Foundation of Public Health Services. First of all, in your packet was the list of all of your agenda items and then bills related to those. This was basically out of date the minute I sent the email to Ann to put it in the report. So there's several things that have happened since this came out. One of which was Foundation of Public Health Services. We now have a Senate version of the bill, and the House bill is scheduled for a hearing on February 8th. In regards to Tobacco 21, I just wanted to highlight that those have moved out of committee and are moving through the process. Under home visiting services on the second page, we now have a governor's request legislation for universal home visiting for all babies in the state. So that's a new one. And finally, the very end, on health equity, there is a bill to create a state office of equity. So we'll be watching that one as well. Huh? At the very last one, under tier 3. So I will be getting you an update on these, certainly for the next board meeting. If any of you want an update on these prior to that, just let me know, and I can get you an update. Any questions on that?
Bill number on that health equity department?
Yeah, I think it's 1783. Yes. Yeah, that one just came out about 2 days ago, so it's not in here. And then once again this year, WASALFO is really looking for local health jurisdictions to do resolutions or some form of extra support in regards to Foundation of Public Health Services. I talked briefly to the board's executive committee, and the idea was proposed to just simply do a letter that reaffirms the resolution that was done a couple of years ago. And I don't know, Brian, if you want to say any more about the idea behind that, but there's a draft of that in your packet.
I don't really have anything more, but just that this is sort of our signature issue for statewide and locally to adequately fund what are the services that we try to provide. So, competing with many other priorities, but we
And-
try to bring our voice to it since it's our mission.
Yeah. And with that letter, I don't know if there needs to be a vote of approval with the board or just passing the letter and then having those wanting to sign on. I'm not sure procedurally how you want to handle that.
So I think the way is that we do a vote, if someone makes a motion to approve it, and then those who vote yes sign, assuming there's at least a majority. So if you're looking for that motion, is there a motion to adopt this letter in support of this funding?
I will move approval of presenting to the board for signature the January 31st, 2019 letter reaffirming Resolution 1609.
Is there a second?
I'll second.
Okay, any discussion? Hearing none, all those in favor indicate by saying aye.
Aye.
Opposed, nay. Any abstentions? All right, hearing none, the motion passes, and I will sign and circulate to other members.
Great. Thank you all very much.
And while we're on it, there was one other thing that I should have put in my chair report that I didn't see, and that is, in the past, we have been a member of an organization called the National Association of Local Boards of Health, and the annual dues for that are $400. But I just wanted to put out there and find out if anyone's actually interested in participating in that. And I don't know that, so. Oh, so this is board member. So this would be board members, would be if someone's interested in participating at the national level. And do you know anything about this? Maybe tell us a little bit about this.
Yeah, NALBO, National Association of Local Boards of Health. It also includes state board members. I was actually fortunate enough to be on the board of NALBO for probably about a year and a half. It's an organization that, again, like NACHO, but specifically for board members at, again, both the state and local levels. It's a lot of it's primarily education, networking, finding out how different boards of health across the states work. One of the sayings that we found very appropriate was that once you've seen one board of health, you've seen one board of health, because they are very dissimilar across the country. And so what it allows Board of Health members to do is to sort of learn more about being a board member, how different boards function, and again, a lot of networking. So it's a good organization. It's, again, closely affiliated with FAB. It's been working with NACHO. It also works with the CDC and a lot of the national organizations, but again, really focusing on education around board members being a Board of Health member.
I have a question. Is it a lot of online learning, a lot of telephone calls, or is it requiring travel somewhere?
It requires, essentially, we have an agency membership, and so if we were to sign off on it, then all board members are automatically members. There are educational materials available online. There is a national meeting, but it doesn't require any time other than the time you want to commit to it.
Well, I would like to say I think it's a very good thing that we participate, and if it covers all of us to get the education and participate, and if there are committees, I mean, I think that would be really good, because I think we have one of the best health departments in everywhere, so I'll support that.
That's great, and actually, I don't know that there's any board action. We just wanted to make sure before we paid the dues that there was at least one person interested. So we've met that threshold. Thank you.
And Brian, if I may, just
Yeah.
give a little bit more state context, is actually, I had attempted with some other board members across the state about 5 years ago to create what's called a SALBO, which is a state association of local boards of health, essentially to attempt to unify boards of health across the state. We didn't get very far at that time, but it's been reinvigorated. And so currently, Tacoma Pierce has a board member who has decided to, A, be a board member and participant on the SALBO committee for NALBO, and then also look at how we could create a SALBO, a Washington State Association of Local Boards of Health.
Mr. Chair, one of my concerns is that with 12 of us on this board, that we have to make sure that we will be attending the meetings. I would think rather than find a dandy if we have the association, however, if no one wishes to participate, and it's kind of silly to go ahead and do that unless there's some other offbeat information that we would receive not being in, not participating in the board.
I would like more information.
Sure. And I'm, okay. Sure. And I'm happy to provide any offbeat information you'd like, Mr. Hafner.
My concern is, of course, is that, we do have committees, and we're having a difficult time as it is to have membership in attendance. And here again, if this is something else that's extremely important for this board, then I would think perhaps kind of an appointment of one of us that feels free that they have the time to do that, not me if I'm not saying myself, but others, then at least we're having people in attendance in order to get the information.
So I just suggest as chair's prerogative, perhaps Dr. Lutz, if you could just circulate a quick email with a few links on both the national piece and the state thing, so people could have some links and know. And the dues are $400 a year, so it's not a big commitment for us to keep that door open. But it sounds like there's enough interest that we shouldn't change our practice. Okay, next up is the financial report from Mike.
Thank you very much. I mostly want to talk about audits today. It always seems like there's some type of audit going on here in the building, whether it be DEA looking at things in treatment services, or whether it be the State Department of Health doing programmatic audits of those individual programs. But the big audit we always have every year is the Washington State's Auditor Office that comes here and does our audit. And normally they come at one time. We have an entrance, they do the audit, they have an exit, and it's all done and finished, and I come and report the results. Well, this last year, at the auditor's request, they asked to split ours up. So they actually came in early last spring and summer and wanted to look at the 2017 books and did a financial audit. And I did report out on that about 3 months ago. I told you we had a great audit. The results came out very well. But what the part they had to do was they had to pack up, leave, and then they came back in late November and December and did the accountability audit. So now they have finished that work, written their report, and so you may have seen that you have on next Thursday, February 7th at 2 p.m., there's another exit interview with the state auditors. This is the accountability audit results that they're going to come report. And of course, whatever I found out from there, I will report to this board next month as it comes through. But I just wanted I know you guys keep getting blasted with an entrance interview, an exit interview, an entrance interview, an exit, and I just wanted to sort of explain why that was split up this last year. That was mainly due to their staffing, that they had to get all their financial stuff first and then move on to the accountability. So look forward to any board members that want to come attend on Thursday, February 7th at 2 p.m. to attend that exit of the accountability audit.
All right.
Thank you.
Any other committee reports that we haven't heard from? Seeing none, I'll go to the health officer report. Dr. Lutz.
Well, good afternoon. I thought this year, my first board meeting, I'd be doing things a little bit differently. And so what I wanted to do is, at some level, sort of provide a look back and maybe a look forward. And so for those of you who don't know, and I didn't know that, this is technically called a Wordle. And so again, I thought it would be more interesting, rather than just throw a bunch of PowerPoint bullets up there, here are some words that I thought were relevant for what we see as public health issues that we addressed over 2018. And this is maybe a social issue, Wordle. And again, I think that by no means do the size or the color of the words necessarily speak to the importance or the priority. But I think irrespective of how you look at this, I think these issues are very relevant for the world we work in and live in. And poverty in our community is significant. When we have 32% of residents across Spokane County below the 185th percentile, which means they're eligible for a variety of social services, that's of significant concern. That's 1/3 of our population. I mean, so when we look at social determinants, when we look at issues that affect the outcomes that we deal with, this, I would argue, is of great significance. Homelessness, we hear about it, we see it. Right now they're doing the homeless count. It's interesting, last year obviously we know that the methodology was done differently last year, and so the numbers were different. But having been involved with it a little bit this year, I will suggest to you that it grossly undercounts the number of people who are homeless or unsheltered. You know, I was out on Tuesday night past, and literally going into a kitchen and asking people, do you want to talk to me? That's how they get their data. And if an individual doesn't want to talk to the recorder, he or she doesn't have to. So the 1240 last year, significantly increased number, 310 of those individuals were unsheltered. Those are the individuals living in parks, living under the bridges. The gentleman that we talked to the other day, he's a veteran. He's living in Riverside Park. Riverside Park allows him to park out there. He's been homeless for the last couple of months. He's got a medical problem. He probably has some mental health issues. Makes too much money to put a roof over his head, okay, because of some of the criteria. So he's living in his SUV. He's living in his RAV. Okay, he's got a dog. You know, it's a really compelling story. And so again, this is the world we live in, and this is the world we need to address. Inequities, substance misuse. I mean, again, I think all these words sort of speak for themselves. I want to mention one thing about suicide and self-harm. It is a priority within the agency, within the strategic plan. It is of significance for me when I look at the fact that if I look at from 2011 through 2017, I see a 65% increase in suicide rates across the county. Last year, I should say in 2017, there were 122 suicides. 59 were gun-related, so that's 48%. Preliminary data suggests I have 110 individuals who have taken their lives. And of that, again, about 52, 110 right now suicides, of which 52 were firearm-related. I have 40 that haven't been coded yet, and I have 85 that are still at the tox lab to determine how he or she took their lives. So suicide and self-harm is a significant issue for our community. I'll call this the behavior Wordle. Again, a lot of overlap. And we'll talk a little bit about the vaping piece for 2019. But again, physical inactivity as a cause of major comorbidities, heart disease, diabetes, obesity. Again, we're looking at cardiovascular disease as an agency priority for our strategic plan. Smoking, substance misuse. Infectious disease. Influenza I'll talk about measles. With respect to hepatitis B, there were 16 cases across the state last year. 14 were here in Spokane. There are 6 right now cases in inquiry, of which 3 are here in Spokane. So we've had a bit of an uptick in hepatitis B. I also look at what we call STDs, sexually transmitted infections, syphilis, gonorrhea, chlamydia, and these numbers are, I mean, again, really alarming. If I look at from 2014 through 2018, I see a 20% increase in chlamydia. I see a 40% increase in gonorrhea. I see a 750% increase in syphilis. I went from 27 cases in 2014 to 203 cases in 2018, and I still have cases pending. Of even greater significance within that framework of syphilis, I had 1 case of congenital syphilis, which means that that child will have lifelong disabilities. 1 case in 2016, 5 cases in 2017, and only 3 cases in 2018, and I still have 1 pending. Now, good news, and there is good news here, is that we actually, and I say we because the health department was intimately involved in this, we averted 12 cases of congenital syphilis in 2017 and 8 cases in 2018. So kudos to the people that we have here who, the work they do is incredible to recognize, work with these individuals and get them treated. And again, to avert that number of cases of congenital syphilis is really powerful. Environment. I'm very thankful that I'm not up in Chicago, where my in-laws are right now. It's still cold out here. We're seeing more and more extreme weather days. There's actually a state working group right now to address wildfire, air pollution, and how to get appropriate messaging out there to inform people. When I look at air quality, I can say that back in 2014, there were only 2 days of poor air quality in Spokane. In 2018, I had 13 days. In 2017, I had 18 days. You know, some of those days were hazardous for everyone, not just hazardous for special populations, but hazardous for everyone. So again, I think that we have to look at these issues, and irrespective of how you believe they are caused, they are sort of one of those existential issues which we need to address. And here's my 2019 Wordle. And you'll see that there's a lot of overlap between the issues that we looked at in 2018 and 2019, because they're not going away, folks. And so, you know, we're committed to this for the long haul. So a lot of these issues, again, really are priorities for us. We've talked about suicide and self-harm protection. We've talked about opioid use and misuse. And although I'll talk about opioids as a priority, we also have to look at methamphetamine, because statistically, more people are dying of methamphetamines than heroin in our community. Opioids overall, bigger numbers, but methamphetamine is back, and it's back in a big, big way. And polypharmacy, when I look at the preliminary data of how people, again, it hasn't gone to toxicology yet, but I saw more polypharmacy with methamphetamine and heroin and X and Y than I saw just by itself. So again, it's substance misuse. Question marks mean we don't know what else is out there. And so we have to be nimble, and we have to be ready for those emerging issues, such as what we're dealing with right now with measles. But there are other issues which, again, undoubtedly we will have to address. And the neat thing about this agency is that it is very proactive, and it is very agile, and it is very flexible in looking at those emerging issues as they come up. So I know this is what you want to hear about. Oh, back up, if I may. I want to just, when I asked some of the folks upstairs about the behavior issue they wanted me to talk about, and they gave me this. What is this? These are the cartridges for this, which I'll pass this around, but this is a Juul. So you've all heard about it, you're reading about it. Right now, what did they give me? The statistics, 70% of the market with e-cigs or vaping is with Juul. FDA declared it an epidemic. 25% of youth report misusing or vaping within the last 30 days. So this is a huge issue. These are color-coded. So I'll pass this around, but apparently green is cool mint, red is fruit medley, the taupe is creme brulee, and the brown is Virginia tobacco. And each one of these is equivalent to 1 package of cigarettes. So you can see where you could easily sneak this into a bathroom in your high school or in your middle school or wherever and get a hit, well, you're going to get a whole pack of cigarettes in one vape in the bathroom. This is beautiful. I'll pass this around as well. This is the latest. It looks like, I don't know. I mean, but this is also a vaping device. So it's very attractive. It comes in different colors. You can see the different colors it comes in, but this is, again, what kids are being exposed to. And to say that kids aren't being exposed to this or not being targeted with the marketing is, again, denying reality. So this is something that, again, we are very aggressively working with to address at a community level.
Could I ask a question? What is zoonosis?
Zoonosis.
Yeah. I don't.
Yeah, thank you. Zoonoses, and I should also put vector-borne diseases. So zoonoses are essentially those infections which are, at some level, animal infections that then are transmitted to humans. And we're seeing this, again, also with vector-borne diseases. So locally, we've been dealing with West Nile virus for years. It's now considered somewhat endemic. Okay, but, you know, it's interesting right now, we've been investigating a case of dengue fever. Now, it wasn't caused locally, but it's somebody who contracted dengue and is in town, which is another mosquito-borne disease, Lyme disease. Okay, these are all, again, infections which, when you look at it from an environmental public health standpoint, and when you look at it from a clinical standpoint, we're seeing many, many more of these because of the fact that, A, climate is changing, and B, what's called the WUI, the woodland-urban interface is doing this. So now you have people living next to wooded areas, you have increased climate change, increased temperature changes, and these infections are becoming more prominent. Okay, measles. And I will let you know that I will, after I talk here, Susan Joberg will be talking about our response, the agency's response to measles. What is it? It's a virus. It's a viral illness. It's the most contagious vaccine-preventable illness of kids. Children, especially younger than 10, but those at highest risk are under the age of 5. Adults who have never had it have not been immunized. Pregnancy, obviously those non-vaccinated and those immunocompromised. One of the challenges with it is that you can be contagious and not even know it. And so people are very much aware of the rash, as you can see from the image in the top right-hand corner, but the rash typically shows up 3 to 7 days after you've been exposed. And so you're infectious for 4 days before, days afterwards. And so that's why we sort of say that the period by which we will be watching and sort of monitoring for exclusions is 7 to 21 days. Typical symptoms, you get a fever, and then you get what we in medical school learned as sort of the 3 C's plus K, which is coryza, which is essentially cold-like symptoms, runny nose, conjunctivitis, pink eye, cough, and then Koplik spots, which I thought I actually saw a case 2 years ago. It wasn't, but again, they're unique little white patches, sort of bluish white patches in the mouth. I thought I saw a case, but I didn't. But I had to get a dermatologist to confirm that I didn't see it, and he had never seen it. And you know what? I've never seen a case of measles either, because measles was essentially eradicated in 2000 in this country. Okay, the vaccine came out in the 60s. We don't see measles anymore, except in these outbreaks in pockets. Right now, in 2018, 26 states have outbreaks of measles in DC. Worldwide, we're looking at 150,000 individuals who are estimated to have died in 2017 from measles. Estimated since 2000, 21 million lives have been saved from vaccination worldwide. So it may not be, quote unquote, of significance in our states because of medical practices. Worldwide, it's huge. And for unvaccinated individuals, irrespective of where they live, complication rates do exist. Encephalitis, which is a brain infection, which oftentimes leads and will lead to lifelong problems, and pneumonia. Prevention, vaccinations. Treatment, supportive. If individuals are hospitalized, and there's a small percentage of individuals who do require hospitalization, we treat with vitamin A, but that's essentially it. So there is really no treatment for it. And last but not least, influenza. So far to date, close to 200 hospitalizations. They've all been influenza A, 27% vaccinated. Again, primarily in older individuals. I caution saying older individuals since I'm in that age group now. And hospitalizations, look at the red curve. You're seeing that it sort of had plateaued, but now sort of peaking up a little bit, which is sort of what we're expecting to see. Currently, we've seen 11 deaths in Spokane, 18 across the state. 9% of the deaths in Spokane were vaccinated. That means 10 of the 11 were not. Questions for me? Great. So I'd like to then step aside and allow Susan to come up and talk about what we're doing to address the measles outbreak.
Thank you. Good afternoon. So we're feeling grateful, honestly, at this moment that we have an opportunity to prepare for an outbreak. We have been in Clark County's shoes on other outbreaks over the last many years, where we're sort of the first to be responding. And so because of that, we're able to implement improvements that we've been able to make over the last several years, including how we work with and communicate with our schools to support our kids who may be susceptible to measles, their staff, volunteers, teachers. We're also able to do some preparation work around with a health equity lens on creating letters of good explanation that would go home with families, but being able to translate those letters into the various languages spoken in our community that are not English. We're working closely with the healthcare community as consultants. As Dr. Lutz mentioned, a lot of providers have never seen a case of measles in their office. And so providing some of that consultation on what it would look like and education to providers, communicating the guidance around testing. If they feel like they've got someone in their office that has a measles-like illness, what are the criteria for being able to send a sample to the public health lab? What's treatment? Really supportive treatment, and what does prophylaxis look like? So those types of communications with providers. We've also been able to do some role clarification and exploration with our healthcare facilities, so that if a case does show up in an emergency department or in urgent care, what's their responsibility with their staff and those that are in the urgent care at that time, and what is public health's responsibility, so that there's no confusion and we can all act quickly and efficiently in being able to notify and work with somebody who may have been exposed. As I mentioned, we are working closely with schools, including the public schools, private schools, parochial schools. We've been able to expand our list because of the work we do with environmental public health, and their environmental program within schools includes all of those groups. So we're asking them to just encourage that they know the immune status of all of their students and teachers and staff and volunteers in advance. The EPI staff have been meeting with each of the school districts at the invitation of the school districts, just to talk through how we will how they will support students, how we'll be working with them if a case is identified, and what will that mean for their facilities. We're currently working on similar types of communication with child care centers and home care. The communications team has been doing a great job of creating promotions out to the community so that all citizens can learn their immune status using social media posts and other communication, and the status of their own family members. And then finally, promotion of the MMR vaccine as the primary prevention method that's the most effective for preventing measles. Any questions? Anything you think we should be doing?
Yes.
I just want to make a comment and say thank you very much for you and your department and the people that are responsible for this, because we're way ahead of you and I had spoken the other day, and hopefully we can continue to keep ahead of it. So again, as a board member and as I just appreciate, and I'm sure the rest of the board does too.
Thank you.
Thank you so much. Or did you have a question?
No.
Okay. Last in this section on reports is going to be a review of the 2015-2017 Spokane Regional Health District Strategic Plan. Lindia and Kyle.
Chair, you will excuse.
Yes, thank you, are excused.
Okay, good afternoon. I am doing it solo. He's waving from the galley there. So I was asked to come and speak on the 2015-17 strategic plan, and what I thought I would cover is the highlight of accomplishments, some of the challenges that we had, some areas still that we need to address, and kind of the lessons learned that we took from that and how we applied it to the next strategic plan cycle. So the first body of work was really to do a thorough assessment of the mission, vision, and values statements. And it was a staff process, lots of input into it. And what you see here is really the brand new statements that we created. It was much different than from the cycle before. We created 4 goals, so positive work environment, strengthening our communication, really continuing the work around inequities, and developing a strategic health agenda. The way it was structured is that under those goals, we had some action plans, and there were about over 25 action plans that were associated with these goals. Leads were assigned to those action plans, and then the work was to be coordinated with some of our existing committees: Workforce Development, Awards and Recognition, our Living Well Committee, and Quality Council. Then Goal 3 was championed by some of our staff that work on equity issues within our agency. And then Goal 4, we did create a work group that was cross-divisional to do that work. So to assess what happened in the 2015-17 strategic plan, we did a staff survey just recently of those leads of all of those action plans. We have been doing a work plan status report periodically through those years. Our executive leadership team debriefed on it and just kind of talked about what were some of the challenges and things that we felt we wanted to work on. And then that Goal 4 work group did a debrief on it so that we could not do some of the same problems that we had with it for this next round. So on the survey results, just of all overall satisfaction, the leads reported anywhere from a 2.3 to a 3.2 out of a 4-point Likert scale. So average satisfaction. The ones that had a little higher satisfaction were goals 3 and 4. Positive themes that came out of the survey is that there was good communication at the beginning of the cycle, which is a very typical of a strategic plan. Everybody's really happy at the beginning and excited about it, and then it kind of wanes. We had some good cross-divisional work with those committees. The Goal 4 work group was very cross-divisional, came from all of the different divisions. And there were some resources that we had to actually help make progress. So we had the Kresge Foundation funds that really helped the equity work move forward. And then we also had some funds that we put towards a communications survey. Some of the negative themes: there was a disconnect between the agency committees, the content experts, and some of the action plans. With 25 action plans that came out, there was duplication and overlapping, and then there was a lot of work that was kind of then put down to those committees. So for example, the Workforce Development Group was inundated with requests for staff training in many different areas from those action plans. And then, of course, communication did wane, especially in the 2017 year. We had leadership turnover. As you know, our health officer left at that time. Our community and family services director left. Some of the action leads were gone. So when you have that turnover, those vacancies, it really does stall things, and it's hard for somebody else to step in and pick it up. Staff engagement, again, you know, it's always high at the beginning, and then it does wane as time goes. So some highlight of accomplishments. I'll try to go through it relatively fast, but if I say something that you'd like to know more about, just let me know. So with goal 1, it was really around that positive work environment. And one of the efforts was really around staff recognition in helping staff feel that they were appreciated. And the group did a basically assessment of how do staff like to be recognized and what would make a difference in our agency. We had a Making a Difference campaign that came out of the Awards and Recognition Committee, and basically it was different kinds of cards that people could grab and write a quick little note and thank staff, or management could thank staff, or staff could thank management. So anybody could pick up these cards. And it was really around some values of integrity, respect, communication, those type of things. And then we had a manager's toolkit that was developed on how do you recognize staff. Some of the things for staff support was training. We did team building training, conflict resolution, and started using team norms. And not only programs did team norms within their little area, but sometimes we had programs to programs do team norms. For example, my HIV medical case management program did team norms with working with the HIV prevention unit. Totally different staff, had to have a lot of communication so that they would work better together. Executive team did team norming, our joint management did team norming, and what's been good about that is we really do hear periodically about, remember our team norm? Or, you know, how do we make sure that people are really acting the way the team norms are stating? We developed an administrative assistance group. That's a group that a lot of times doesn't get a chance to network and really share, how are you doing purchasing? Or, you know, what's some barrier you're having with travel arrangements or things like that. So that group has been formed. And then with our new intranet, we have the option to do these team sites. And so there's some opportunity to do collaborative projects in those team sites. Then the healthy work-life balance activities. And this really fell onto the Living Well Committee, which is chaired by our executive team liaison is Kyle. They launched the 85210 campaign in 2016, which really emphasizes healthy choices. It's sleep, fruits and vegetables, screen time, physical activity, and sugary drinks. And we had a kind of a competition throughout the agency on that. We established the pit in the basement, and down there are equipment that the staff can use to work out. There's fitness classes, yoga, aerobic conditioning and strength training, and other opportunities just to kind of reduce our stress. The Living Well group did a stress management toolkit that's available online, just giving some resources to people on what they need to do to manage their stress. Launched the 85211 campaign in 2017, which added doing one kindness every day. And then they launched the Keep Calm and Walk On campaign, which really focused on walking and stress reduction. Goal 2 was that improvement on communication, and the communication survey that was implemented was by an outside vendor. And we did get data for the entire agency, and then each of our divisions got our own data. Some of the issues raised in the survey was that there's a silo effect in the agency. I know that you've heard this. Increasing communication from leadership. They really wanted to hear from management and leadership. And that we needed to make some changes on how we put out our information, that there wasn't some good venues for communication. And that we needed to build some trust in areas and make sure that staff felt heard and felt comfortable in sharing some of their concerns. So the activities that we've done over the last couple of years is put together a brown bag speaker series where programs could present different topics that they're doing and staff could go during lunchtime and listen. We do have our new website, and that's helped with getting some more programmatic information out there. Our intranet site and these team sites have been very helpful. We launched the district's health, which was articles by upper management Torney, our administrator, would put out articles, our health officer, one of the division directors would put an article out. And so trying to increase that information that staff are wanting from leadership. We did quarterly forums with the staff and an annual all-staff meeting, and the topics that are presented in there are mostly kind of what's currently happening either in the community or in our agency. And then, as you know, we had Dr. Eiten come in and talk more about equity last year with the all-staff meeting. We did restructure joint management. We now have a co-chair type of facilitation where an executive team member is co-chairing with a manager. And so trying to get the managers to be more involved in that meeting and feeling that they have more say and can have more kind of influence on what we're doing in that group. We have the hubbub now. That is the replacement of Monday Mail, and it's allowed us to be a little bit more flexible on how that information comes out. Monday Mail was pretty stagnant, and we couldn't really, I guess, do it the way we wanted to get the news out there. And then again, the Office 365 features are helping us with different things. Currently, staff are being trained on the use of Yammer, which I know zero about, but it's something like a Facebook type of social media where you can follow each other on different topics and kind of keep reading those feeds so you can get informed of what's going on in a certain area. That's all I know about it. So goal 3 is to reduce inequities, and we've had inequities on our strategic plan for, I think this is the 3rd time, and we've just kind of keep being build on it. The Kresge Foundation grant has immensely helped us with having some funds to actually bring in some really good trainings. Initially in the year, we did an assessment. It was actually by Bar High, which is down in California, and it was a validated assessment that we did in the community and then we did with our staff. And it helped us identify kind of the level of where our staff were at with things and what other trainings we should bring in. It helped us see where our community, where they were at and what they felt public health should be doing around inequities. We've had staff trained in intercultural development inventory assessments, and they have gone to different divisions and assessed every staff. The staff would then get a personal assessment of where they were with cultural competency, and then they were coached on some of the things that they could do to improve their competency. Lily Farhang with Human Impact Partners was brought in and created kind of a champions group around equity. I think 50 staff were trained in 3 or 4 sessions, and they were pulled from all of the divisions in our agency. So we had that cross-divisional experts or champions. We're using the Health Equity Guide, and that's out of the Human Impacts Partnership also. It is a great tool if you ever just want to go online, and they have a lot of other resources that we've tapped into, but they really are public health focused, and they're really helping us see kind of the work that we need to continue or build on. And then our all-staff meeting, like I mentioned, with Dr. Tony Aitan with the California Endowment. We also had him for breakfast with our community and got some really great reviews from that. We have formed a Health Equity Advisory Committee within the agency that is really trying to help move this work forward, not only internally, but starting to take it out to the community and working with different partners. And then the policy partner tool, we've been using it internally. I was on that committee for a while, and it is kind of a neat experience going through that and really thinking through how a policy might impact different populations, and really to use that equity lens. Linda Graham and Rowena have made a good team about going out and not only speaking on the equity side of it, but also that health in all policies concept. They have been to SNAP, City of Spokane, the Mayor's Cabinet, the City Council, I think, is next, Spokane County, Washington Nonprofits, Center for Justice, She's going to Spokane Law and Justice Council, and so she's really starting to get out in the community, and we've been getting some really good feedback on that tool. Then the fourth goal is the strategic health agenda, and what this group did was a lot of process work to align with the upcoming community health assessment that happened in 2018. We found that there was a little bit of misalignment with this goal and where we were with the community, and we wanted to really kind of align so that we're working together. As a committee, we revised our strategic management system, which is a FAB requirement, the Public Health Accreditation Board, where our strategic plan should be aligned with the Community Health Improvement Plan, and it should be aligned with our Workforce Development Committee, our Quality Council, and the other work that we're doing in the agency. So to align all of those things, it really took us some thinking through about how we communicate, how we work across those committees, and that type of thing. Then, as you know, the community held the big assessment process this last year. We were very integral in that process, and that's where we pulled our priorities from. And I'll talk a little bit about the priorities that were selected. So, yes, there were challenges. Some of our FAB requirements were missing in the 2015-17 process. Data itself was not used in the process. It was really an internally kind of focused organizational development process, which sometimes is good for a strategic plan, but for FAB requirements, they really want us to use data and to align with the community with that community health improvement plan piece. Like I mentioned, we had staff turnover during that time period, and that was a challenge. And then the way it was structured with the different action plans, there was really no body of oversight. And so, you know, the Goal 4 group had a work group, and so they were kind of in their own work, but the other ones just had these individuals doing the action plans. And so it was just the way it's set up was really a struggle for us. No real reporting, oversight, nobody to really help with the barriers or the challenges that different people were seeing, and so it was really hard to move things along. And then just the sheer number of action plans was a struggle. So when you have 25 different action plans, that really stretches the staff, and it's hard for them to you know, move things along, because this is kind of extra work on top of their regular jobs. And that brings me to the Goal 4 work group, which the idea of this work group was really to come up with some priority health issues. But our struggle was, if we were to do that back in 2015 on top of the 4 goals, we would end up with another 3 priorities, and then we'd be stretching our staff even thinner. So the group really chose to do more process piece and align us with the 2018 Community Health Assessment and push that priority selection out to 2018. Hopefully that made sense. Still to address, we're just going to continue building on the communication issue. Now that we've got SharePoint, the new SharePoint implemented, and Office 365, our new website, our new intranet, that is really helping us. Things were kind of on hold when we were waiting for those things, so that will just continue. Wellness activities will continue. Our whole organizational culture and team building, we are now doing the trauma-informed trainings here and really talking about being more understanding and kind and having grace with each other and with our customers and clients. And then we'll just continue on that equity focus. What we carried over that really we did not get to was we really want our staff to feel competent and that it's a part of their job to communicate out about public health. So it may just be public health in general, but it also may be about how do you talk about working upstream, or the equity work that we do. How do you apply that lens to your own program and talk about it? And then also, some of our programs, like immunizations, really have to think through the messaging that they do so that we don't make the public or clients defensive? And how do you think through about what you say does make someone defensive or it resonates with people, and really having that kind of training to understand that. We also wanted to have a collective effort with our community around a priority, and that was that alignment with Priority Spokane, Providence, Multicare, Kaiser, and all those other entities that are doing the work. We have some work to do internally on cross-program sharing. Some of our programs have the same target population. They deal with school nurses, or they deal with healthcare providers. And we have to figure out a way that they can really kind of network around that and share how they're working with the different entities. The other day, in one of my division meetings, we were talking about our partners, and CHAZ was mentioned by about 4 different programs. And we're coming at CHAZ in many different ways. So how do we coordinate that work better, not inundate CHAZ, thank them for their partnership, because they're a huge partner for us, and really do a better job of how we're working together. We also would like to do a better job with how we refer our clients within the building. And we have, I can't remember how many direct service programs, and a lot of times our staff don't even know how to refer to each other or what the criteria is of how do you refer a client. So we want to do a better job with that, and then also a better job of linking with the community. So I just want to briefly talk about kind of how we use those lessons learned in going forward with the development of our next plan. And then I know it's on the next agenda to really talk about the outcomes of the strategic plan and what we're doing there. So, as always, the start of a strategic plan, you review your mission, vision, and value statements. So we did a staff process with that, and everybody was really pretty happy with what we did the last time, which was very positive. The 2 areas that they felt may have been missing a little bit was inclusivity and that we're data-driven, we're evidence-based. So we did add this last little part on the mission statement. Of all people through evidence-based practices. And that helped like the data center or communications feel more a part of the mission statement. So all the inputs that we used to deciding our priorities, we used data. We maybe went overboard on data, but we really did use data. So the Bar High Health Equity Survey that was funded by Kresge, we used the kind of top issues that people said were happening in our community. We had a quality of life public survey, and the public commented on the top concerns they felt were going on in the public. Healthy People Task Force, which, if you remember, there was 6 task force going for the community health assessment, and we took the top 3 priorities out of that task force. We did some staff focus groups on what were they seeing in their programs, or what were they hearing in the community. With Spokane Counts and all the data and indicators that's on there, we have a formula that puts the ones that are not doing very well in the red, and we took those and threw them into the bucket. Then we took the final 3 priorities of the community health assessment and put them in. And then we also did an inventory of our national, state, and local stakeholders, just to make sure that we were kind of aligning with in case funding was available, or, our Washington State Department of Health, there's bound to be funding coming from them, just to make sure we're kind of aligned with them. All of these inputs went into a bucket, and then using our data center and criteria, we did a prioritization matrix. And it was probably the most extensive, robust process that we've ever done. It wasn't just dots on the wall or, conversations around the table, but it really was making it more quantitative and analytical. And the top 3 that came out of it was family violence, behavioral health, which is mental health and substance use, and then under that, you'll see 3 or 4 that's really related to chronic health conditions. And so we kind of grouped those into a category. This was the results of the community health assessment process. So 2 of the ones that came out high for us were also 2 of the priorities from the community. The one that didn't come out high for us was the affordable housing one. The staff voted, and reducing impacts of family violence was number 1. So the 3 priorities for our next round is family trauma and violence, cardiovascular disease and our behaviors, and behavioral health. And then we've got a reporting plan set up and a communication plan, not only with our staff, but also communication going out to the community. So, any questions?
I think you mentioned it, but the plan is to take where we have been, where we are currently, and then talk about the future at our next meeting, because we thought it was too much to do all in one, and we want to get board feedback and input. So we've just right at the edge to what it is looking like from a staff leadership perspective. So.
That was a good idea to do that.
Yeah. Yeah.
Of course, one of the things that I think we're concerned about is looking at the results. And that number 1, you have the resources to be able to do all of this. And I think that we have discussed that previously.
Yeah.
And so it's great what you're doing. But again, there has to be an end result and what's happening by going through all this process.
Yes. And Heidi will talk about performance measurements and outcome measurements next time. We've got the data center wrapped right into the strategic planning process, so we make sure that we can report out on some indicators and data points.
Any other questions, comments? All right. Thank you for that very comprehensive report. Oh, sorry?
No, she can step down, but I have some comments.
Comment away, Dr.
Yeah,
Lutz.
so just, again, to put this in context and why we identified family violence. So again, some of the numbers and again, statistics, data. An estimated 3,300 incidents of violence on an annual basis on average in Spokane County.
Reported.
Reported. Thank you for the caveat. We know that it's oftentimes underreported. 2,000 children were identified in 2016, 2017 as being involved, reported. 25% of all criminal cases involve domestic violence or intimate partner violence. Estimated $6.7 million in 2017. So again, some of the data that were used to inform us as to why that is a high priority for us. I would also just put in the fact that when we're identifying the role of adverse childhood experiences in so many of the outcomes that we deal with, be it substance misuse, be it continued partner violence and domestic violence, we're seeing ACEs now identified with a lot of other traditional medical issues, such as heart disease. I think the more that we can work at that level, the better that we're going to be able to impact our community. I will put a plug in for Heidi. She is also the project manager for both the Regional Opioid Task Force, as well as a forming suicide prevention task force. So again, she is multitask, but again, to have her in that position for me has been a godsend. And then 2 final comments. I misspoke when I talked about the World Health Organization's estimate of deaths in 2017. It was actually 110,000, not 150,000. I also wanted to thank Amy Jennings for that really cool wordle. She's in our communications department, did some really cool work there. And then finally, again, I'm really impressed about how proactive we've been around the whole measles issue. 39 cases at the state level, 38 of which have been in Clark County, 1 in King County. 1 has crossed the border into Multnomah County. They are all either unvaccinated or no documentation of vaccination. There's been 1 hospitalization. They've all been, or the majority have been under the age of 18, but some young adults as well. We are internally meeting regularly. We get daily information from the state level, and health officers are again meeting regularly to discuss the issue. We're really approaching it not so much as if, but when, because of the fact that measles by far and away the most contagious childhood infectious disease. Essentially, 9 out of every 10 individuals exposed to it who are unvaccinated or are at risk will come down with measles. So, thanks.
I have a question. What is the morbidity, mortality rate of measles?
Nationally, and within the U.S., and again, and generally speaking, within developed countries, it's less than 1%. When you look at it at a world level and or in populations who may not have access to some of the care and some of the resources, it's between 3 to 5%. I think the thing that I talked about, a complication, something called encephalitis, although the incidence is not that high, essentially you're looking at a lifelong disability. So although the morbidity associated with it, specifically panencephalitis, is not great, the long-term complications are significant.
That's why they both need to be added together, I think.
All right, we're coming back out of executive session into general session. The last thing on our agenda is any board member check-in, good for the order. Vice Chair Wick, anything?
Nothing major, but just kind of exciting news. We have a group that's going to start a local farmers market this summer in Spokane Valley. So we're excited to finally have a Spokane Valley farmers market.
I just want to say, Mike, I will not be able to attend the February 7th exit conference for the accountability audits. So if anybody has the chair of the finance committee, I've got a employee connection to do at Spokane County that day at that same time. So if anyone else wants to join them.
I'd like to speak regarding the transmission.
The transmission committee.
That's it. They're really on the go, so it's a transmission. But they've really done a yeoman's job. A meeting, as we said, Monday mornings at 7 o'clock and continuing, but it's going well. I think, as Kevin mentioned to you, we're in the process now of the agency that we selected. I wanted to elaborate just a little bit more about the agency that we did select, because one of the questions we had asked them previously, what's your success record? You know, and they were saying it's around 95 to 98%. And of course, our people are well qualified in this particular arena that they're going to be looking at, you know, and looking for an administrator with that kind of health background is going to be somewhat difficult. Secondly, that we figure that anyone that is outstanding in that portion of it is probably under contract. And so we're going to have to reach, finally, when we come up with some candidates, we probably will have to go before their board and request that they are able to talk with us. So we're looking at a lot of small hurdles that we'll be able to overcome, but overall, it's just going very, very well. And I just want to thank the committee for I'd say the yeoman's job of working on that.
Mr. Kearns, anything?
So, we forgot our jokes, so we'll have one next month.
Notice it's we,
Yeah.
and this is member check-in.
Yeah.
How about the haircut?
Yeah.
Oh, I think I did that one in here, didn't I?
We'll tell us again. Okay, so, do you guys know how the man in the moon cuts his hair? He clips it.
We hadn't heard it.
No comment. So I have a couple things. Went to the 50th anniversary of Valley Hospital. Multicare has had that for about 18 months. Yes, several of you were there. It was kind of funny because my mom and dad took us there when the hospital opened. I was a sophomore in high school, and it was a big thing to have a hospital in the valley. So it was like, yeah, I've been here all this time. And then I'm like, oh my gosh, I've been here all this time. Also, our Spokane Valley Youth Voice is doing a community conversation on February 11th. I have some paper handouts here if anybody would like it. The youth have really come together and looking at issues in the community that they feel are very concerning to them. Vaping is one of the things. The bathrooms at our high schools, several high schools are closed, several bathrooms, because so much vaping they can't go into the bathrooms.
The doors are being taken off.
Yeah, well, some of them are locked and the doors are taken off, so that's something. They're going to work on mental well-being, safety, substance misuse, youth jobs, and living without a home. They do not like the word homeless because there's a stigma around homelessness, and so we've been always using living without a home or sheltering. I liked it when you talked about sheltering. So that's Monday, February 11th at 6 to 6:30 gathering. There'll be booths and networking, and then their conversation from 6:30 to 7:30. So I have that. And the last thing is I got selected to be on a National League of Cities Public Safety and Crime Prevention Committee. So in March, I'll be going to the national conference. And if there is anything that you'd like to bring up, I thought we have a lot to share about the marijuana information about what's happening with, how cities can look at it and lessons learned, that kind of thing. Also talking about, I know one of the shortages that I'm going to talk about is the shortage of law enforcement officers as far as public safety. It looks like we've got about a 30% shortage coming up with retirements across the state and the nation. So anyway, that's my update.
Mr.
I do have
Hefner?
one last comment.
Yes?
I'm involved in the SCOPE program. That's 300 to 350 community members throughout the county that assist in Nelson Sheriff's Office. In May, I'm not quite sure the date yet because we haven't firmed that up, we're going to have a SCOPE program and law enforcement and how we should be supporting it because they're getting all kinds of raps at this stage. And we feel that with the 350, on a Saturday, they'll go door to door with a pamphlet explaining to you what SCOPE is and how we support the deputies and the sheriff's office and law enforcement and so forth. So that information I'll bring forth to you, but it's exciting because if we can get 350 people going door to door throughout the whole county, that's an effect. Besides that, the county's going to do something for us too.
Yes, we are. Proclamation. We can talk about it.
Excellent.
Ball's already rolling.
Okay, good.
Write it. So
You just got to know the right people, that's what it is.
Can you ask Linda, when is your youth?
Monday, February 11th. I could pass them once I have
What's
here.
the
Some of the-
location?
Location, Center Place.
Center Place. Thank you.
And I just wanted one health update. I announced to two of our members at a different meeting this morning. We started our meeting this morning together. But the city, county, and city of Spokane Valley meet at a regional governance every other Wednesday, and they announced that we're having our staff meet together to coordinate a homelessness plan. And so that's a really encouraging thing. There's different pots of money that go through those different government agencies. And we have to, I forget by what year, but come up with a regional plan. And so those staff members are starting to meet. Eventually, I think at the elected level, they'll meet. But I was encouraged by that because that seems to be the emerging local issue, at least that's in the media. So I wanted to say that. And then secondly, I just wanted to give some kudos to Mike and Ray as keeping things running. It's a long transition. They're, coming up after a longtime leader, and that's challenging. And there's both people who want them to be like the other leader, and then there's other people who are happy the other leader's gone, and they're willing to try to impose their will. And so it's a wild road for them. You might not know that from seeing them calmly sit here, but they have lots to do, lots going on, and they're working closely with the transition team to keep that going. But I just want people to know that they've got their regular jobs and then they've got this job, and it's a particularly challenging one, I think. So thank you for your work on that. And then I also want to just commend Ann, who also has now become the shadow executive director, whether she wants to or not, to keep things going and keep communication going. So thanks for your work on that. And with that, we're adjourned.